Let's just start with your plan for this special session. You've talked about it several times. Just kind of briefly talk to us about it.
Well, let me go back to why we're here today.
Okay.
We're here today because we have tried basically everything that we know that's available to try to shore up our general fund, which has been anemic for 30 years. And it funds our Medicaid program, but it funds other things too, mental health, and it funds DHR, it funds our law enforcement. There's so many things that it does fund, but right now our problem is Medicaid. When I came in office, we cut the size of government. We put in efficiencies that saved $1 billion a year for the people. We had to borrow money in 2012 for 3 years to shore up the general fund. Last year we tried to pass some fair taxes. We passed some, but really it's not enough. And so that's where we are today. We're trying to institute regional care organizations. And regional care organizations will be a better delivery system for Medicaid to the people that we serve. We're not going to be able to do that with the amount of funding that we have right now, but we need some long-term funding. We don't need to have to do this every year to try to find some one-time money to shore up Medicaid, which is really a bare-bones type policy anyway. And there are children and there are people in this state that so depend on Medicaid. You know, we have 500,000 children that are born into poverty every year, and that's not their fault, but they're on Medicaid. And those children are not going to have a healthy life unless we provide health care and primarily a doctor's care for those children.
Okay, and when you released your plan, you talked about it generating $225 million annually. Some legislators are doubting this number. How did you determine $225 million?
Actually, my executive business office worked on this. They looked at other states our size. We feel that 225 may be a low number, but we wanted to put a low number in there to begin with. We don't know exactly what it will be. Obviously, other states have some good customers from Alabama. So we're going to be taking customers away from Alabama if we have an Alabama lottery. But we feel like that it will generate at least that amount. And right now, that will be adequate for several years, we believe, to take care of the general fund.
Okay, and let's talk about this multi-state lottery, Powerball, for example.
Right.
How will you pay for that, and how will you join in? Where will that money come from?
Well, in the constitutional amendment that we have set out, it allows us to join in compacts to institute multi-state lotteries like that, because I believe that that's what people like that. You know, they get excited about a $500 million possibility of winning. So we just felt like it was important to go ahead and have all the things scratch off, as well as the multi-state lotteries and the Powerball and things like this. So we'll be looking into that. Actually, it's complicated. So once the legislature says we're going to allow the people to vote on it, we will begin to work immediately on how we will institute that in the state of Alabama.
Okay, and speaking of that, are you open to more gaming and gambling options? We have a place that used to do bingo here.
Yeah.
Would you be open to that, to looking into something like electronic bingo?
We really are not for that. That is not in our package. I want a simple lottery, and the reason I do want a simple lottery, I really don't want the massive expansion of gambling all over the state. And our polling shows that the people don't want that. A simple lottery, though, is really something that's very popular with the people, and I believe it will pass overwhelmingly if it's a very simple bill and lottery bill that's put out there. I'd rather not have massive expansion all over the state. But you know, it's not about a lottery. It's really about the people. And everything that I'm doing is about the people. It's about those children that can't take care of themselves, and the elderly, and those that are disabled. My emphasis is not on the way we get there. I do want it as clean as possible, and I don't want to hurt our state with it. But I want, if it comes to choosing between a lottery and helping our people, I'm going to choose our people.
Okay, and some legislators would say there's already a fix here. Make some type of compact with the Porch Creek Indians.
That's not enough money. We've already looked into that. We have talked, my legal people have talked to the Porch Creek Indians. We know that there is just not enough money there to do that.
So it's not even an option
No,
anymore.
it's not. Now, I mean, it'd bring in some money, but certainly not enough to do what we've got to have.
Okay. Now let's play a game, the what if game. What if the legislature decides no? Then what?
Well, then we will probably get out like I have the last 2 weeks, and we'll be all over the state again, and we will again ask the people to ask their legislators to let them vote on it. Let the people solve this. And I will probably do that for about a month, and they may come back in.
Okay, the legislature says yes, it goes to the people for a vote, and the people say no.
Then that will be up to the people. Then we will do what we can do, because I believe in the people's right to vote on any issue. And if the people say no, then we will abide by what the people say, and we'll do the best we can.
Okay, Jim McClendon proposing another lottery plan. Are you open to compromise, to working, and adjusting your plan possibly?
Well, let me say this. He is pushing my plan, and he's also going to introduce the plan that he had by talking to everybody in the legislature, I think. That particular plan passing the House, I don't think is going to happen. Okay. The House members tell us that they want a simple lottery. Some of the members of the Senate obviously want some of the more complicated things and to take care of some of the areas where they represent. I understand that. We will see what comes out of the Senate, what goes to the House. The House then will make their adjustments. They may adopt a simple lottery like mine and send it back up to the Senate. And if the Senate they may substitute the bill when it comes to it. The legislative process, we just have to let it work. And this is a constitutional amendment, so when it leaves my hands, I really don't have any say-so over what happens to it, but we can campaign for things.
Correct.
And that's what we'll do.
Okay, and if it is approved, what do we do right now to fix those Medicaid cuts? Because it will take some time to generate revenue. It
will take, by 2018, that's when we will start seeing some revenue coming in. I have ways to work on that right now. We have some BP money that was left over this year. I have $50 million. 15 of that will go into paying off the Alabama Trust Fund that we borrowed in 2012. $35 million we can put into it, but I'm just not going to have enough to really get to the $85 million deficit that the legislature put us in. And what's at stake on this, there's two things. One is the institution of our regional care organizations around the state, which really are a model for the country. Mm-hmm. And CMS wants us to be able to succeed. And they wanted us to succeed so much that they gave us $748 million to institute these around the state. But we're going to have to give all that money back. We're going to lose $748 million if we're not able to take care of this deficit.
Okay, and you brought up the BP oil spill money very briefly. That could get brought up this session. Where do you stand on an agreement? What could happen with that?
Representative Klaus had I think, a very good bill that passed out of the House last time. That money actually belongs to the whole state. I negotiated that money. I negotiated that with BP, and past administrations were going to settle for $148 million. And I told them, after we looked at the losses that we had, that I would not take less than $1 billion. And so they kept coming up, and finally they agreed to the $1 billion. So that's how we got $1 billion. So I negotiated that, though, for the entire state of Alabama. That's going to be paid out over 18 years. But we can take out a bond issue and let that money pay for the bond issue, and we can pay off debts. And that's what I really want to do. I want to pay off all of the rainy day fund debt for the general fund, and I want to pay off as much as we can of the debt that we incurred in 2012.
Okay, and my last question about the lottery. Some people are wondering, why did you make cuts to Medicaid payments to doctors at the end of this budget? The budget was fully funded. A new budget for the session doesn't start until October 1st. You made the cut around when kids would start school, maybe need shots and physicals. Some legislators are saying that you're trying to pressure them to pass this lottery. Your response?
Well, we had to go ahead and make a decision on that, and so we decided that we had to go ahead and do it August the 1st. I didn't want to do that. But CMS told us that is the only thing that we will allow you to do. We wanted to cut some other things, But that was the only thing that CMS would allow us to do and still institute our regional care organization, still keep the $748 million. Now, as soon as we can get some funding, I'm not talking about the lottery, but some other things, maybe the 1st of October, whenever we can get some extra money, I'm going to restore that, because there's nothing more important than the doctors and the healthcare providers who take care of the patients. And, I was a provider for 35 years, and I took Medicaid. And I understand what it is to basically really make no money off of Medicaid. You really lose money. I lost money on almost every patient that I saw. But they have to be seen. But primary care doctors, so many of them, especially our pediatricians and our primary care physicians, they have so many Medicaid patients. They cannot operate an office and pay overhead and pay nurses and light bills and all these things. They can't do that unless they are adequately compensated. And they just really don't make a lot of money. People think that doctors make all this kind of money. They really don't. And they're having struggles making ends meet and paying for the overhead in their office. And so we've got to adequately compensate them so that they will be there not only to see the Medicaid patients, but to see me and you.
Okay, thank you very much. Those are all my lottery questions. One final question. New state superintendent announced yesterday, correct? Right. Some backlash today that he hasn't really served in the classroom.
Okay.
Your response to that?
I don't care.
Okay, anything? that works for me.
I truly do not care about that, except this. He cares about teachers, and he cares about the classroom. And he has been involved in reforms in Massachusetts, where Massachusetts is #1 in the nation, and we are 51st in the nation. Now, there is nothing more important to me than the classroom teacher and the principal. Nothing more important. And the education of children is dependent on our classroom teachers and on our principals. But he can administer this overall Department of Education and come up with some new ideas that will support our teachers and our principals. And that's where the support ought to be.
Okay, good answer. Anything else you want to share with us about the lottery, about the special session?
I just want to say that, again, this is really not about a lottery. I know that people who really want a lottery, I understand that. But to me, it's about the people. This is truly about the people that we have got to serve. And everyone, every legislator ought to look at who they serve. And they serve people. They represent people. And there are people out there hurting. There are people out there that are poor. And that's not their fault. They need good health coverage so that their lives will be better and they can better themselves and get a job and do the things that will help their families grow and thrive. I just think that we just have to remember that we need to come down always on the side of those that are hurting and the people of this state.
And that's what it's about, the people.
It is. It's about the people.
Okay, thank you very much. Any other questions? Anything else?